Hi guys, my name's Ella. I'm going to be showing you how to explore the linguals of number 29 and 30. So first, I apologize for the angle. The linguals are so hard to record, so this is as best as it's going to get. So the first thing I'm going to show you is how to find your modified pen grasp. So basically, for the modified pen grasp, you're going to take the three fingers, which are your thumb, your pointer, and your middle finger. Your pointer and your thumb are going to be across from each other on the handle, and then your middle finger is going to go on the shank of the instrument, and then you want to make sure that the instrument is resting between your second and third knuckle, and of course standing tall. So that's how you would find your modified pen grasp. Now, when you introduce the fulcrum, you're going to introduce the ring finger, and these three fingers are going to be married. So as you can see, that is how the modified pen grasp is going to go. When you include your ring finger, that is how you would fulcrum. So your fulcrum is what helps you stabilize in a patient's mouth or out of a patient's mouth. But for number 30, you would fulcrum two to three teeth away. So in my case, I'm going to fulcrum on the facial of number 28 when I'm working on number 30. Now, when you want to find the correct working end of an instrument, I'm going to try to adjust this so you can see well. You're going to take your instrument and you're going to put the tip at the distal, so it's in between the teeth like that. Now, as you can see, if you can see, the terminal shank is parallel to the distal of the tooth, and that's how you know that's the correct working end. Now, the incorrect, I'm going to show you that, is you would take the instrument, and as you can see, when I place the tip in, it goes like a kind of across the tooth. It's a hard angle to see, but it goes across the tooth, and that's how you know it's incorrect. So again, the working end goes parallel to the distal of the tooth, and it goes over the tooth. Okay, so when you start, what activates the lateral motion and what type of stroke is produced? So what activates the lateral motion is when you're working on number 30 and you're fulcruming on number 27. You're going to take your instrument, go in your modified pen grasp, and go to the distal lingual line angle. What activates that lateral motion is basically kind of your wrist and your fingers. You're pulling towards yourself. And when you're going towards the distal of this tooth, that is going to be a vertical motion in between right there. While you're going towards the medial, that is going to be an oblique stroke. The strokes, you want them to be small overlapping strokes. So when you are working on number 29 and 30, you are going to be sitting at either a 10 or 11 o'clock position. And you're going to start by having your elbow in when you're working towards the distal. You're going to start working in small overlapping strokes. And then as you get towards the interproximal, your elbow starts to go out. And then once you are in the interproximal area, you are going to use your wrist to activate that vertical stroke. And again, small, slow, overlapping strokes. So that's how you do that. Now, when you're pivoting, you're using your fulcrum finger. So as you pivot, it rotates with your fulcrum. So when you want to go around the line angle of a tooth and you want the instrument tip to follow that line angle, you are using that pivot. So small overlapping strokes. And then if you want the tip to adapt to the tooth, that's when you introduce your roll. So the roll that you do, that is what your index and thumb are doing. They're rolling the instrument so that you can get that tip of that instrument around the tooth and not poking the gums of the patient. So again, I'm going to show you the mesial aspect now. You're going to flip it so the tip starts pointing towards the mesial. Your elbow is going to be really high out, and you're going to be fulcruming on the facial of number 27, and you are going to do some small overlapping strokes. Make sure to start pivoting and bringing your elbow in and rolling the instrument so that you're not poking the gums. And then once you get into that interproximal area, you're going to use that wrist motion to activate vertical strokes. And the same thing with number 29. I'm gonna sit at a 10 to 11 o'clock position, start at the distal lingual line angle, make sure I have my modified pen grasp, start there, small overlapping strokes, elbow in, and then as you get to the interproximal area, elbow out, and then you're going to activate that rocking side to side motion to make sure to get a vertical stroke. And then you're going to flip the instrument as you're heading towards the mesial, elbow obnoxiously out, small overlapping strokes, make sure you start to pivot and roll. And then as you get to the interproximal area, you're going to rock your wrist to get in between. And then the last question, what is the goal of exploring? The goal of exploring is a lot of things. You want it to use for like detection, so detections of frications, detection of like tooth anatomy, any calculus, subgingival or supra. In our case, for exploring, the number one reason would be to detect any subgingival calculus. So yeah, thank you.